You know, if you talk to most people in the country about whether we need reform of our healthcare system, they'll say yes. But what they're thinking about is stopping the skyrocketing cost of healthcare and increasing access for those who are uninsured or underinsured. Yet what we have before us is a bill which will not do that, and in fact increases the cost of health care to the government by nearly $1 trillion. And even that number is managed because the income of the bill is begun immediately, whereas the actual expenditure parts of the bill are delayed for about 4 years, so that we really are not seeing a true measure of the cost of the bill. Some estimates are that the true cost of this bill over a 10-year period will be closer to $1.7 trillion. It's remarkable that the markup started out with an amendment simply to allow us to have the language of the bill in front of us for 72 hours before we vote on it, and that amendment was defeated. It was defeated by arguments that the bill language would be too confusing to America, that legislative language can't be understood anyway, so we don't really need to have it in front of us, that the precedent of the committee is not to operate this way, and remarkably, that it would delay our consideration of the bill, delay our meeting the artificial timeline that has been put upon us. The final thing is, I think also that the markup has made it very, very clear that if you want to keep the health care coverage that you have today under this bill, millions of Americans will not be able to, regardless of the linguistic arguments that have been made in the committee. The reality is that CBO has made it very clear that in one very obvious case, in Medicare Advantage, over a 10-year period of time, this bill will reduce the additional benefits that Medicare Advantage beneficiaries have by a little less than 50%. Those people in our country, and Medicare Advantage is increasingly one of the most popular parts of the Medicare system. Those who are in Medicare Advantage who are hoping to transfer into Medicare Advantage can no longer expect to have that kind of a system, because it will be gone.